viewers of this podcast. I extend a very warm and heartfelt welcome to all of you. My special respects and regards for my gracious President Fogsi, Dr. Sunita Tandulwadkar, Madam, and a hearty welcome to the great renowned orthosurgeon, Dr. Sishud Babulkar, to this podcast today.
Thank you.
ज्ञान का बहता अनोखा रोज एक नया रंग हर रात 8 बजे आप जुड़िए फॉक्सी के संग. And today we are live telecasting episode number 171. And we are wondering, are we creating a record? Are we marching towards creating any record? This podcast is a great conglomeration of specialists of various fields, and this brilliant idea has been conceived and is presently executed by our President, Dr. Sunita Tandulwadkar, Madam. Madam is head of the department, Ruby Hall Clinic, and she is a great ART consultant and a pioneer in regenerative medicine in our field. They say, Vyasochistam Jagasarvam, there is no topic under the sun Maharishi Vyas has not touched. And there is no area in OBGYN field Dr. Sunita Tandulkar, Madam, as a president, has not explored. May it be numerous, more than 20 publications, books published, and many various projects like thalassemia eradication, then adolescent health, preconception care. She is acting on all fronts, maybe social.
Rashmi, today is your day with Dr. Sishud.
Okay, ma'am. It's a great honor to introduce Dr. Sishud Babulkar. As we all know, he's a very renowned orthosurgeon, and he is the president of Trauma Society of India and also president of Osteoporosis Society of India. He has been the youngest orthosurgeon in world who have had MCH in orthopedics from Liverpool, England. To his credit are many orations and keynote addresses, a brilliant academic person with lots of gold medals to his credits, and books published and publications in index journals. He has been consistently organizing largest trauma care conferences in every year. He has started first space theatre for total joint replacement at Nagpur, and he is also a TED speaker and also a philanthropist. I must say that his work is known during COVID pandemic, when he opened his hospital for all the patients. He's taking care of immigrants, he's taking care of handicapped children, school children. He is also extending his care for animal care, and he has also adopted a village for tribal care. So it's a great honor to welcome Dr. Sishud Babulkar to this podcast today.
Thank you.
Madam, we would like to have your guiding insights to this podcast.
Thank you, Rashmi. Thank you so much. First of all, Dr. Sishud Babulkar, it is our honor that on a Fogsi platform you are there. You know, you may be president of various organizations. We all lead our organization because it's our passion to be working in the organization. And then we climb up to that level. But what touched me more is your philanthropic work. I definitely feel that I am a spiritual person. I believe in spirituality. हम खाली हाथ आए, खाली हाथ जाएंगे. What is important is what karma you are carrying with you. And when I heard that you have taken a village and you are doing for the special children, the help and all, that matters to me more. The footprints what we keep on this earth is more important than in our bank balances and all this. Jo hai naseeb mein wo aayega. What is important is this life, we got an opportunity to be a giver than the receiver. And we should use this opportunity to the fullest. I believe in it. So same with this attitude, we have a sponsor of birth for those underprivileged who cannot afford IVF, but who need only IVF to have a baby, and only because they are poor and government hospital don't have these facilities, they can't have a baby, is very painful to see. And in 2018, my sponsor of birth, where we help these underprivileged people to do the free IVF treatment, is going on. And it's so much pleasure to see the happiness on their faces when they conceive.
True.
Similarly, I think in Solapur Medical College, I donated my endoscopic surgery unit over there because I felt that the woman there, they gave me a chance to operate. No, they never bother who is going to operate. They are just eager that they got a bed for getting surgery done, and they always felt housemaids are the one who are operating, who are working for them. They don't even know the seniors, and that's where I felt our surgical hand becomes so superior because we get to do so many surgeries in our residency, and something we need to give back to our alma mater. We need to give back to those women, and giving those never knew that your name will be given to the operation theater. I think that is a footprint we keep on this earth before we leave. So this has touched me, Shushruth, very much. And Rashmi, just one correction. It's not 20 publication. There are 18 books and 85 plus publication. I haven't stopped counting after that. But anyway, this is important because it takes a lot of hard work to write the books and write the publication. Anyhow, sir, it will be such a great pleasure, and we will tell all our organization members that such a beautiful conference is going to be there in second weekend of August, and would love to meet you sometimes personally, definitely.
Absolutely.
Thank you for coming on a Fogsi platform and guiding. These 30 committee chairperson do these 30 podcasts. Every committee chairperson has been given a specific date of the month, 30 days. They are not allowed to do any webinars. No one attend webinar. One person, it may be academic, non-academic, spiritual, political, any inspirational personality from the global zone, they take out. Believe me, with this 180 podcast, I feel I evolved. Otherwise, where I will know Dr. Babulkar, where I would have interacted, where I would have known your work. So as a person, more than my chairperson, I evolved. And I thought these chairperson are our future leaders of the organization. Let me give them a different opportunity just to have 1 hour dedicated, podcast with any personality. They will develop the confidence, they will develop their oratory skill, their creativity will be shown. But more than them, I'm getting benefited knowing so many great personalities. So thank you so much on a Foxy platform, and I will join the viewers link to listen to both of you. Thank you.
Thank you.
Thank you so much, ma'am.
Thank you, Rashmi. Enjoy your podcast.
Thank you, ma'am. So again, a very heartfelt welcome to Dr. Sushruth Babulkar, sir. Welcome, sir. And many congratulations on forming this new society, Osteoporosis Society of India. It has really created a great buzz amongst, not only among the ortho surgeons, but also among the gynecologists, because this topic is close, I think, to both the fraternities. So why such insistence on osteoporosis? What is the significance, and what was the purpose behind forming this association?
Of course, we all know, Rashmi, that osteoporosis is a silent disease. But what we do not realize is how bad or how worse it can create as a problem. Now, the issue is, we as orthopedic trauma surgeons, we face the aftermath or the complications of osteoporosis not been looked at or not been handled early on in women mostly, but even in men. So these days, in last 10, 15 years, we have seen a huge rapid increase in fragility fractures, which are secondary to osteoporosis. And we as technical handlers of these complicated, complex fragility fractures are facing huge issues in terms of number one is fracture fixation technique, because the bones are brittle, bones are weak. So any implant won't hold the fractures together till they heal. So that's a major issue. So the entire armamentarium that is required, implant material, techniques, tips, tricks are different, and they are evolving, and we are continuously facing challenges and trying to solve them in terms of putting broken bones, broken fragments, comminuted fragments together till fracture heals. That's number one issue. Number two issue is because there is osteoporosis, the ability of the person, the patient, has gone to docs in terms of fracture healing. So you need longer time. Fractures tend to have delayed unions. Fracture tends to have non-unions. And there is a continuous race between fracture healing and fracture fixation. So before the fracture heals, the implant walks out. That's our second challenge. The third challenge is, and WHO has recorded this 15, 20, 30 years back, that if there is a fracture neck of femur, an example, in a old lady, it's a fragility fracture, it's a fracture because of osteoporosis. So we hear that story that that old lady in the neighborhood was in a bathroom, she fell down and she had a fracture of the hip. Actually, she takes a turn to pick up the soap, she breaks her hip bone and then she falls down. So the sequence is different. Sequence is not because she fell down and she sustained a fracture, but she broke her hip bone first, which was already weak, and then she fell down. And all these fracture neck of femur old ladies, despite of the best of the treatment, despite of the best of the fixation, despite of best of the surgeon in the town, 25 to 30% of these women die within 1 year. So that's the huge statistics, and now is a time when it is rising. We need to look at it. We need to address these issues. And why we need to also look at it is we have realized that it is not only orthopedic surgeons. Of course, we are the ones who receive the patient of osteoporosis, but that's after complication has already occurred. So what we want to actually do is we want to address this issue when it can be handled well, when it can be looked at and addressed at an age when peak bone mass is still evolving, which is 25 to 35. So we want persons to be handled when they are still young by endocrinologists, by obstetricians, gynecologists, by physician friends, so that all these complications can be really dealt at an earlier age. The problem that we again looked at is every specialty, gynecologist, endocrines, physicians, orthopedic surgeons have their own way of dealing with the issue, osteoporosis. They have their own way of dealing with the issue, guidelines. And if a patient, for example, comes to me and I put the patient on teriparatide, which is one bone forming agent, because the patient already has a fracture, I have fixed the fracture, now I want an active agent to form the bone, to actively have fracture gum up faster before the implant which I have used fails. And if the patient happens to go to another specialty, they would stop that medication and give them something different of their choice. So there was a discrepancy between all of us as to what is suitable to that patient at that point in time, at that particular juncture of complication which has already occurred. And this is what I faced within our medical field. So it is a time that we all come together, agree on one pathway to be given to our patient, so that we take care of the patient, we take care of the persons, we take care of peak bone mass, we take care of the people at large when people before land up into any issue. And that's why Osteoporosis Society of India was formed a few months back with everyone together. And it's my request, it's my humble request to even Fogsi, which I'm talking to come together and join hands, because we all are looking at you to attack persons who come to you.
Maybe as the primary care physician,
Yeah,
maybe.
and also primary care physicians and also endocrinologists between the age of 15 to 25 to 35, when we are still trying to improve on their peak bone mass.
Absolutely, sir. So now, when I was preparing for this podcast, then at that time I came to know that this is such a vast topic. It has such a vast significance and importance, and how we are not giving much attention to a patient who is a young patient. We are dealing and talking with various problems related to OBGYN, but we are not giving any emphasis or any stress or any importance to her bones, and the bones which are so fragile. And I think looking at the huge statistics, I think we have a lot of work to do, and you have started this work, and it's a great thing. So, sir, do you think this uniformity in the medicine or treatment or the multidisciplinary approach, that's going to help us a lot, and what more we can do for
Oh,
that?
absolutely, it will help. I'll give you another example. Another two examples to answer this question appropriately. Number one is I was part of developing guidelines for postmenopausal osteoporosis, which Dr. Meeta Singh had led. She was captain of the ship, and I was the orthopedic surgeon involved. There were endocrinologists, there were rheumatologists, and we developed beautiful postmenopausal osteoporosis guidelines. But problem is, unless and until it is also supported by one umbrella, like Osteoporosis Society of India, which contains orthopedic surgeon societies like Trauma Society of India, which contains Fogsi, which is obstetric, which contains ISBMR. So all have to be under one umbrella, so that all the associations will also adopt what we formulate. So that's one example. Second is, let's say a woman who is premenopausal goes to an obstetrician or a gynecologist, and you guys bravely give her HRT. If the same patient come to me for low back pain, me as an orthopedic surgeon wrongly stop HRT, because we are afraid of HRT, because we have heard that one literature
But there are many myths
talk
regarding
about
it.
CA breast, so we abruptly, reflexly stop HRT and we give something else. We all should be taught together that there is one guideline, and HRT is good and is very effective, and we as orthopedic surgeons need to adopt to it and not be afraid of HRT, and this has to be told by one guideline, which I hope will be developed by Osteoporosis Society of India, and which I hope will be adopted by all the medical specialties across.
So Osteoporosis Society of India, is it on the way of making guidelines? Why? Because that is very important, and I think it should be as quickly formed and quickly implemented,
Yes.
looking at the problem.
If you look at the society at large, I'm the president, but secretary, of course, is a gynecologist, well-known Dr. Nandita Palshetkar. And of course, we are trying to develop guidelines, not only as a whole, but guidelines how to use calcium, guidelines how to use vitamin D, guidelines how to use bisphosphonates, guidelines when and how to use HRT, guidelines when and how to use more stronger agents like teriparatide or resizumab. So there are some newer agents also which are extremely effective and which we all need to be aware of. I know there are gynecologist friends of mine who are afraid of using teriparatide. So we have to take away the fear of these very strong anti-osteoporotic agents from the various faculty of medicines. And of course, there are ways, there is time, and there is a timeline which we all need to understand, which we all need to educate our own colleagues. And I'm sure this multidisciplinary approach of forming Osteoporosis Society of India, with your help, with help of endocrine friends, with help of rheumatologist friends, with help of physician API coming together and joining Osteoporosis Society, we will have only better patient care. We will have only better bone health to all our patients, to all our parents who will need it, to all of us, we are going to need it.
So there is involvement of orthopedic surgeons, the OBGYNs, the physicians, the endocrinologists especially. Do you think, sir, that there could be some help from the people who would suggest lifestyle modifications and related factors in this regard?
So technically, we have also included lifestyle modifiers, physiotherapists, nutritionists as associate members of this society. So technically, they will not have voting rights, but they will have education rights, and they will have, of course, contribution in forming the guidelines, which we all will interact, form, and educate ourselves. Yes.
So generally, you have been seeing lots of these patients, sir. So do you think in our society there is awareness about this problem? How do you find it?
Unfortunately, no, because I think gynecologists and obstetricians typically you tend to see patients at a very early age, which is between let's say 18 to 35 during their obstetric period, when you should be giving them adequate dose of calcium and vitamin D so as to raise their peak bone mass to adequate peak bone mass. Unfortunately, we are not seeing that, and that's why fragility fractures are huge. Now, there is an interesting fact which has come up in our orthopedic trauma field. And what is that? In last 15 to 20 years, we are looking at bad fragility fractures in women around 65 to 75. And if we really look at it, 20 years back when they were 35 to 45, their peak bone mass was very low. And why was it low? Because that point in time, which is 20 years back, there was a fad of zero figure. There was a fad of growing slim. And in that fad, they did very bad dieting. They followed very bad lifestyle, and they were not supervised by their family physicians, their maybe obstetricians that time, maybe their endocrinologists that time. And so peak bone mass was already low, and so they ended up having bad fragility fractures today, 20 years later. So it is your duty, it is my duty as physicians at large to raise their peak bone mass to better, so that 20 years from now, at least they will be better off. So it has to be a balanced diet. It has to be a good calcium, vitamin D rich diet when their peak bone mass is still evolving. Why I'm shouting peak bone mass is because peak bone mass can be achieved better when they are still young. And it is our duty to have and catch them young, rather than they having fractures and me having to fix very difficult, badly shattered bones.
So when we talk about this young generation nowadays, they are too much into exercise, sir. They are crazy of strength training, etc. Does this help in maintaining the bone mass? Do you think it has got any importance, or it's a sort of a layman type question to you actually?
No. It's a great question. So all the exercises, especially, have to be weight-bearing exercises and not only yoga, because yoga, of course, will give you brilliant joint mobilization, but yoga typically will not give you strength in the bones. And as I always say, beauty is bone deep, and beauty is not only skin deep. So we have to make our bones stronger, number one. Number two is, of course, exercises, weight bearing and muscle training exercises is a great idea, because we don't only talk of osteoporosis today, we also talk of sarcopenia, which is decreased muscle strength. Because if the muscle strength gets decreased, which is osteosarcopenia, then person tend to fall. So we not only talk about having stronger bones, we also talk of prevention of falls in view of poor muscle strength. So bottom line, we need exercises. We need to train them weight bearing exercises. We need to train them resistance exercises to build the muscle parallelly, which will also yield better bone strength. So don't only depend on yoga, which is joint mobility exercises, but add on to it running exercises or fast walking exercises and using weights to have muscle training to combat for sarcopenia.
So this is fantastic. Beauty is bonding. Wow. This is something, a new slogan I would like to say, and this is very good.
Yeah.
So, sir, can we catch them young? Is there anything, something like we say screening or something we can identify the problem earlier?
So we are talking to our pharma friends who have graciously agreed to support us in having one of the companies is going to give us 100 venues and sites to have all these guidelines to be interacted and disseminated amongst various societies all across the country. So I hope if we disseminate these guidelines, which will also tell and teach our gynecology friends, teach our endocrine friends, teach our orthopedic colleagues to teach our patients who come and seek our opinion for various other reasons. That's number one. Number two, we are also looking at BMD camps using portable DEXA machines because portable ultrasound machines are useless. What we need is portable DEXA machines, and they are there now, which we can carry at various places, and they will serve two purpose. It will give us population-based guideline so as to direct our persons to take calcium and vitamin D or add on to their diet adequate amount of calcium, vitamin D and other micronutrients, minerals, so that not only bones become stronger, but muscles also behave properly to support this bony skeleton. So it's possible to catch them young, and I'm sure with the help of all the faculties coming together, we will be addressing this issue when they are. But we have to understand this, and we need to really wake up the society that only doing erratic diet is not useful or it's not health friendly.
This is a complete multidisciplinary approach, and as again I would like to say, sir, we have a long way to go actually. If we really want to look into the problem, and can artificial intelligence help us in this regard somewhere?
So we had a talk during the first national conference of Osteoporosis Society, and there was a touch base to artificial intelligence. Of course, if we can have some data, we will be able to apply artificial intelligence in picking up persons who are prone or more prone to develop osteoporosis later on. And we will be able to address those persons that, okay, this is what you're doing wrong on exercise front. Okay, you are doing this wrong on nutrition front. Okay, this is your lifestyle modification which is required. And we can pick this up from a data of 10,000 people like this. So I'm sure artificial intelligence will help us in identifying those prone young persons, families, so that we can address this issue. Yes.
Yes, sir. And then something I would like to say from my end that there are many myths regarding HRTs, and also there is some fixed population of premature ovarian failure also. So they also are very susceptible, as we all know, and we also need to look into patients with premature ovarian failure. And sir, when I read your biodata, there is a special mention that you had been to the TED Talks also. So would you like to tell us something about it?
So yeah, I had delivered my TED Talk a few months back. It actually was awarded to me for my philanthropy work. And since your president is so much interested in spiritual and philanthropy work, let me make two mentions of what I have been doing apart from orthopedics, which is my first love, of course. So this was many years back when I started going to a place called as Tamia in Satpura Mountains, which is top of the Satpura Mountains. And there I started doing charity work to a community which is Bharia community. This community was involved in tree cutting of Satpuras, and because I was treating them free of cost, they started listening to me. And of course, I could stop them from tree cutting, but then I had to engage them in some other way. And I ended up building a property at Tamia, which is today called as Serendipity. And a lot of Amravati
Yes,
people
yes.
have visited this property. So this property was built by this tribe, Bharia. I taught them how to do civil construction. I taught them how to do plumbing work, electrical work. So 300, 350 people worked there relentlessly for 3.5, 4 years and built this property, which is one of the five-star resort today. All the skilled workers then shifted to Indore, Bhopal, Raipur because they were skilled workers. 100 people still were left. So Taj Group taught them how to do housekeeping, kitchen work, told them how to teach, taught them to do reception work, and all the paraphernalia, the ground level work today at Serendipity is done by these tribal people. I ended up adopting all those 14 hutments of Patalkot, and Serendipity is run by all these Patalkot people. My second philanthropy work is there are a lot of young kids between 5th to 7th standard because of their handicap. Either they are walking with a limp, either they have some cerebral palsy, spasticity. They are dropped out from the school because they feel shy because the other kids, they tease them. So every year around 250 school children are picked up by government, Nagpur district, and they are brought to me, and I operate on them. I operate on them and I give them physiotherapy for a year, and the next year though they go back to the school. That 1 year they are kept at Matrusya Sangh, and I operate them at Matrusya Sangh, and they are given schooling. They do not lose their academic year, and every year we operate around 350 children, and I've been doing this since last 10, 12 years, and that's my second philanthropy work. So I've been actually doing this. I don't make a big show about it, but TED identified it and they asked me to talk about it, and that's what I did during my TED talk. So that was my TED talk.
Amazing work, sir. Splendid work, seriously. And what about the tiger, sir, you have adopted? And
So, so this was a tiger who was caught by some poachers, and he lost his paw, and he was limping, and so he was rescued by forest officials and was brought in Gorewada Rescue Center. I was responsible with the help of my colleagues from University of Leeds to give him an artificial limb, and we operated on him, and there was a painful neuroma which was formed because of the nasty poachers trying to catch him. And today he is back in the gardens of rescue center without any pain. Though he's refused wearing the artificial limb, he is pain free and he's walking around. So that's a big relief to the tiger. And I have adopted him, and Sahib Rao is his name.
so the Vidarbha knows you as a very renowned orthosurgeon. So we said the doctors, Sushant Bablikar. And we all know, especially the Vidarbhais, they know that you open your hospital for COVID patients in pandemic. So this is all together, it's a great work, splendid work, amazing work, sir. And this Osteoporosis Society of India, which We understand that we have a long way to go, and it's a brilliant idea. It's a brilliant association you have formed. We wish you all the best, and I would like to ask you, sir, some insights or the salient points for this regarding this osteoporosis to this podcast.
I think we all know it's a silent disease, but we all must also understand that if we catch them young during their peak bone mass development period, all of us coming together as a multidisciplinary approach to build their bones, I'm sure India will be a stronger nation to come. Stronger nation in terms of health, stronger nation in terms of having longevity. So it's not only about longer life and just numerically growing old. We have to grow old, healthier old.
Quality of.
We have to have healthy people growing old so that we live a good quality of life when we are still old. So that's what is our responsibility together, and that's what we should aim for, and that's what we will do.
So thank you so much, sir. It was great. It was a great pleasure and a great honor for me to have you today with this podcast. And I would like to be associated, and we will be talking more about this association and society sometime again, sir.
Thank you very much for inviting me. I truly appreciate that. And I hope Foxy will join hands with Osteoporosis Society of India, and we will take it further. Thank you so much.
Definitely, sir. Thank you so much. Thank you very much.
Take care.